This narration follows the member, provider, payer, and post-care journeys shown on screen. Healthcare journeys often become fragmented across member applications, provider systems, clinical reports, claims platforms, and post-care programs. HEA&L by RastrAI connects these participants through one coordinated, intelligent workflow. The journey begins with the patient, who wants to understand the status of her colonoscopy claim. Through the HEA&L Care Assistant, she can ask a simple question without navigating multiple portals or contacting different departments. The Care Assistant connects with the relevant back-end agents and identifies that the claim is still in edit status because the final colonoscopy report is missing. The patient is informed that once the finalized report is received, the evidence will be updated, the claim will be rechecked, and the case will automatically move into post-payer validation. The workflow then moves to the provider. After secure sign-in, the clinician receives a notification highlighting the missing evidence and the action required to move the case forward. The finalized colonoscopy image is uploaded into the clinical imaging workspace. The AI performs a preliminary read, identifies and segments the region requiring attention, and presents the finding with supporting visual evidence and a confidence score. The platform then generates structured findings and prepares a preliminary AI-assisted draft report. The clinician can review the highlighted region, validate the findings, modify the report where required, and provide the final clinical sign-off. The AI assists the process, while the clinician retains complete control over the final interpretation. Once the report is finalized, it becomes part of the member's evidence record. The patient is automatically notified that the finalized colonoscopy report has been received and that her claim has progressed to the next stage. The journey now moves to the payer. Within the claims administration workspace, the platform validates claim information against patient data, policy requirements, coda notes, clinical evidence, and applicable rules. During post-payer validation, the claim edit is loaded, clinical concepts are standardized, evidence relationships are evaluated, and the appropriate validation skills are selected and executed. An AI-assisted report is then generated for payer review. For the patient's case, the payer can see that the finalized provider report has been received, the claim edit has been resolved, all required evidence is available, and there is no missing documentation. The assisted review has passed, allowing the payer to approve and complete the claim with clear evidence supporting the decision. The journey continues even after the claim is processed. The patient is enrolled in an outside hospital post-care program where her finalized report, claim status, pharmacy information, adherence status, and recovery requirements are brought together. The care program monitors her post-procedure journey, confirms that there are no urgent concerns, and schedules periodic follow-ups. These include a post-procedure symptom check, a 7-day recovery follow-up, and a 30-day medication and recovery assessment. Care teams can monitor the patient alongside the wider patient cohort, identify care gaps, prioritize high-severity cases, review open findings, and intervene when human support is required. Finally, the patient receives a clear update confirming that her colonoscopy claim has been processed and approved, along with the expected payment timeline. No additional action is required from her. HEA&L unifies member engagement, provider workflows, clinical evidence, payer validation, claims processing, and continuous post-care monitoring, creating one connected journey while keeping clinicians, care teams, and payer professionals in control.